Good morning, everyone. For me, it really is an honor to be able to kick off the inaugural Leo Gerard Legacy Fund lecture series. Leo has been an ally for CROSH since I was researching in my undergraduate degree. He has always been the most enthusiastic and passionate person in the room when it comes to worker health and safety. I really do hope I can display his enthusiasm and passion while discussing my research on occupational vibration-induced injury and disease with all of you today. Fortunately for me and everyone here, Workplace Safety North, or WSN, recently published their work with the Occupational Cancer Research Centre, OCRC, in Ontario to rank the occupational disease risk in 3 industries. They used health data from the Ontario Cancer Registry, OHIP, and hospital records, I believe from 1964 to 2020, to determine these results for mining, forestry, and pulp and paper. Before we look at this together, it's important to note that not all diseases are studied or recorded in Ontario's occupational disease surveillance system. So something like noise-induced hearing loss, that is the leading occupational disease in all of these industries from WSIB, is noted separately here at the bottom. I've broken these down into 4 categories for us to review. There are the cancers: laryngeal, lung, oral, colorectal, pancreatic, and leukemia, and non-Hodgkin's lymphoma. Then there are diseases specific to the lungs. I know I put lung cancer with the cancers, but there's silicosis and idiopathic pulmonary fibrosis, asbestosis, asthma, and COPD, or chronic obstructive pulmonary disease. These are all typically from prolonged exposure to some kind of airborne contaminant. Then there is the heart and blood flow problem, causing acute myocardial infarction in all 3 industries. And finally, what we're here to talk about today, the effects of vibration exposure. So carpal tunnel syndrome, Raynaud's syndrome, and noise-induced hearing loss are all on the list of the top occupational diseases, with carpal tunnel syndrome being first or second for all 3 industries that we saw. Today, I'm going to talk about the human response to vibration exposure from 3 perspectives. So the seated mobile equipment operator, the operator holding a vibrating tool, and the operator standing on a vibrating platform. So I'm going to define the anticipated symptoms of these types of exposure and where the research is at for applying the hierarchy of controls to all 3 of these situations. So to start, what is the human response to vibration? Studying the human response to vibration is truly multidisciplinary in nature. So if the phrase human response to vibration is deconstructed into its component parts like we see here, then we can understand that a complete grasp of the discipline requires an understanding of the human. So the biological, anatomical, and physiological aspects, their response, so psychological and biomechanical aspects as well, and the nature of the vibration. So in terms of the engineering and underlying physics of that exposure. Although most researchers have a focus in one of the 3 main areas, it's that underlying understanding of the interactions between all of these that's essential for continuing to develop our understanding of the full response. Before we dive into occupational exposures and the research, there is some background information and terminology that we should all get familiar with. So the 3 main terms being the characteristics of a vibration signal, what does transmissibility mean in terms of vibration exposure, and finally, why is resonance important here? Vibration is actually a form of mechanical wave that oscillates about fixed points. That's the formal definition. So it's kind of like noise in that way, where they're both waveforms. Vibration can enter the body through any point that is in contact with the vibrating surface. So in the case of the seated operator on the right, there are 3 contact points: the back, the buttock, and the feet. You'll see vibration results defined in terms of their axes. Typically, you will see the triaxial configuration here with the 3 axes for X, Y, and Z. So X being that forward and backward direction, Y is the side to side or lateral, and Z is up and down or vertical. So there are 4 characteristics of a vibration signal that need to be taken into consideration for occupational exposures. Duration or the length of exposure time, the amplitude or magnitude, or the bounce height of the waveform, like you see here in the image. Frequency is the number of bounces per second, and typically it's reported in hertz. And the direction, which we discussed previously on that other slide with the 3 axes. Measuring the transmissibility is one method of understanding how vibration is transmitted through a structure. So in the simplest form, transmissibility refers to the ratio between 2 points. For example, we can simultaneously measure the vibration on the platform and then measure vibration on a point on the ankle, and the transmissibility is the ratio between the ankle and the platform. So if the transmissibility is greater than 1, this means the vibration has been amplified through the structure. And if the transmissibility is less than 1, the vibration has actually been attenuated in the structure. So when it comes to defining the resonant frequency or resonance, the easiest way to do this is a demonstration of some wave addition. So if we consider the blue wave to be the body's natural frequency, which every portion of our body has its own, then we consider this teal wave to be the vibration exposure frequency. So whether this is from a seat, a tool, or a standing platform, when we add these 2 waveforms, the combination of the frequencies is in orange here. So in this case, these 2 waveforms cancel each other out, and we get a very low amplitude combination. But when the waveforms are the same frequency, when our body's natural frequency matches the frequency we're being exposed to, the resultant waveform actually has maximum amplification. So this is called the resonant frequency. And it's at this frequency that tissue damage and strain levels are the highest. So this is where it's resulting in a greater risk of injury. Each region of the body has a resonant frequency, like I said. So for whole body vibration exposure, the resonant frequency of the pelvis is 3 to 5 hertz, and the lumbar spine is 10 to 12 hertz. When we are referring to hand transmitted vibration exposure, the hand arm is 30 to 50 hertz, and the fingers are higher frequency here at 125 to 300 hertz. So you can already see that injury risk from whole body vibration and hand transmitted vibration happen at very different frequency ranges. With foot transmitted vibration exposure, it remains the least studied type of human vibration exposure, and the resonant frequencies of different areas of the foot were only systematically identified during my PhD research. So during my experiments, resonance at the ankle occurred between 16 to 39 hertz, the midfoot between 51 to 84 hertz, and the toes between 99 to 147 hertz. Knowing the resonant frequencies really is what allows us to safeguard against exposure to the frequencies that have been linked with an increased risk of injury. And finally, how we categorize or classify the type of vibration exposure is important. So it should be based on the contact point with the vibrating surface. I'm hopeful that we can start to isolate whether the foot transmitted vibration exposure occurred as a result of seated whole body vibration exposure, or whether it was the foot solely in contact with the vibrating surface from standing foot transmitted vibration exposure. So to date, Categorizing vibration exposure has been difficult because in an example as simple as a forklift operator here, the operator is ultimately being exposed to all three: hand transmitted vibration through the steering wheel, foot transmitted vibration through the pedals and floor surface, and whole body vibration through the seat surface. I think we all have enough of a foundation in some of the vibration terminology now to start more specifically exploring the research. So let's start by looking at what happens to the operator when they are exposed to whole body vibration. We'll look at this in a sense of the seated operator. So the acute, in other words, short-term or immediate or by the end of the workday health effects can include muscle fatigue, discomfort, or distorted motor performance. The operator could experience headaches, dizziness, or motion sickness. The operator's heart and respiratory rates will increase from the vibration exposure. There could be decreased cognitive functions, impaired speech and vision, and reduced vigilance. While the chronic or longer term can happen in 2 months to years, health effects can include lower back pain, spinal degeneration, shoulder and neck pain, digestive problems, for example, the suppression of gastric functions. There is a possible increased risk of prostate cancer. And finally, noise-induced hearing loss. More often than not, vibration creates noise. Ultimately, there's a lot of research findings that seated operators exposed to whole body vibration are at an increased musculoskeletal disorder risk, with neck, shoulder, lower back, wrist and hand, and knee pain are possible. One thing we do know is that lower back injury risk increases when whole body vibration exposure is combined with non-neutral postures or rotated or twisted postures. So in this figure, on the left, you can see a neutral posture is where the neck and trunk have zero flexion or rotation. Then there are varying degrees of neck flexion and trunk rotation from the neutral posture. So in posture 4 here in red, with the 45-degree neck flexion and trunk rotation, the muscles around the spine are tense, and so they're more rigid. So the stiffer and more rigid the back, the greater the transmission of vibration through the back into the head. So this affected discomfort and injury risk in this study. Another risk of high levels of whole body vibration is noise-induced hearing loss. Here's a table showing the time-weighted averages over an 8-hour shift for miners. So for reference, the maximum permitted daily duration for 8 hours of noise exposure is 85 decibels. So decibels are not a linear measurement. Something to keep in mind, they are logarithmic. All of these miners are exposed to noise above 85 decibels, with their maximum allowable exposure times for a workday being half an hour to 2 hours. So there are standards for measuring and evaluating occupational vibration exposure. For the purposes of this presentation, we will just discuss the International Organization for Standardization, or ISO standard, but there are European Union directives, there's the British Standards Institute standards. In short, the ISO 2631-1 standard, it does use the most dominant axis, which is usually the vertical or z-axis. And after a bunch of calculations, the exposure is extrapolated over an 8-hour health guidance caution zone. So here, values below 0.5 indicate health effects have not really been observed. With the health guidance caution, if it's within the health guidance caution zone of 0.45 to 0.9, this indicates caution with respect to potential health risks. And then any values above 0.9, they actually indicate health risks are likely. So to take these measurements, an accelerometer in a seat pad is fastened to the seat between the ischial tuberosities, or the hip bones, then the operator sits on the seat pad and operates the mobile equipment as normal. We can look at some examples of mobile equipment whole body vibration exposures. So the equipment names are on the left. The little icons of them are on the right. The minimum is the light yellow bar on the left. 25th percentile to 75th percentile is the orange bar, and the 75th percentile to maximum is the light yellow bar on the right. We can impose the vertical lines here with the lower and upper action limits of the health guidance caution zone on the figure. And you can quickly see that all of this equipment operates within or well above the upper limit of the health guidance caution zone, meaning these operators are all at an increased risk of injury, with health risks being likely. So what are the control strategies for whole body vibration exposure? As a quick review, in occupational health and safety, we typically will apply the hierarchy of controls. So you will see the HOC acronym throughout the rest of the presentation. The hierarchy is an inverse pyramid with the most effective controls at the top to the least effective controls at the bottom. Most effective is elimination, so to physically remove the hazard. Then there's substitution, where we try to replace the hazard. Trying to engineer something to isolate people from the hazard is the middle level of control here. The most commonly implemented controls are administrative, where we're changing the way people work. And finally, that personal protective equipment, or PPE, is the least effective control to protect the worker. I've tried to summarize the hierarchy of controls from the top to eliminate whole body vibration exposure. Ideally, we'd have all remote operated mobile equipment. Then for substitution, we would find equipment with lower whole body vibration exposures. To implement this, it would require equipment purchasing policies with selection specifications of your desired exposure levels. So that person would have to be educated enough to be able to interpret the vibration results of different equipment. For engineering controls, we'd select and install seats that reduce vibration transmission to mobile equipment operators, which would require periodic seat maintenance or replacement programs. There has also been some research regarding the use of synthetic rubber additions to truck beds of large capacity dump trucks to reduce the vibration to the operator. To test the seats, there is a value called the seat effective amplitude transmissibility, or seat value. This value is a ratio of the transmissibility of vibration from the equipment floor, the input here, to the seat surface, the output. Again, where ratio values below 1 mean that seat suspension system has attenuated the vibration, and values above 1 mean the seat suspension system has amplified the vibration to the operator. Here's an example of underground seat measurements I have taken. There's an accelerometer in the seat pad directly affixed to the seat and a magnet mounted accelerometer on the floor. So keep in mind how filthy this equipment is given the work environment. So attaching the accelerometer is not always straightforward. Here's an example of the seat results from a study of 4 different seats. So the first 3 are passive suspension air ride seats. A passive suspension system typically relies on springs and dampers or an air bladder to absorb shocks. So this is not adjusting to the conditions in real time. Then there is the active suspension seat by Bose. Active suspension systems are the most advanced, where they are designed to monitor the vibration inputs and adjust the damping characteristics in real time to provide the highest level of vibration isolation for that equipment operator. The 2 columns on the right are the time to reach the EAV, or exposure action value, and the ELV, the exposure limit value. These are the limits for the European Union directive. You can see in orange that the first passive air ride seat reaches the exposure action value in 6 hours and 51 minutes. So this indicates the operator wouldn't be able to finish an 8-hour shift without risk of vibration-induced injury. The second passive air ride seats allow the operator to operate for a little over 10 hours. And the active seat gives the best results where the operator won't reach that action value for over 24 hours. Administrative controls will always have the most options. So for whole body vibration, we can have road maintenance programs, including paving the most frequently used paths. There are GIS-based vibration measurements with which, if we were to combine these first two and use the GIS measurements as indicators of where our roads need the most maintenance, that would be the most effective. We could also adjust the inflation rates of tires or do more regular track maintenance if the equipment has a track. Setting workplace speed limits is really important. Operators tend to travel faster when the equipment is unloaded, but this can actually cause larger jolts to the operator if traveling on the same train when compared to a loaded vehicle. Health and medical surveillance to capture symptoms early. The way that technology is advancing, we are getting closer to having more affordable and usable portable technology for whole body vibration surveillance and prevention. But at this point, the accelerometry can be $10,000. It has to be calibrated annually. The wires are not always meant for industrial field conditions, and you have to have expertise in how to take your field measurement and calculate all of the standard values for comparison. We could do seat adjustment training, which I'll get into shortly. Break scheduling is important to making sure that the worker has the opportunity to get up and out of the seated position, just like an office worker would. And 3-point contact is here because exposure to vibration for 3 to 4 hours can actually cause postural instability. It's very important that operators know to take their time when they get up to get out of the equipment and then use 3-point contact to climb down. So here's an example of what GIS-based vibration measurements on different surfaces could look like. This was a study from 2021 conducted on construction equipment in Spain. They classified 4 sections of road, and you can see S1 is, quote unquote, the worst or the off-road condition, and S4 having a paved road condition for this work cycle. Here are the vibration results for 2 drivers. To interpret these graphs, the green area indicates the vibration was below the health guidance caution zone, and the red area indicates the measurement was within or above that first threshold value of the health guidance caution zone, meaning the operator is at an increased risk of injury. So you can see the squares, section 1, there's triangles, section 2, and the occasional circle from section 3 resulted in measurements above the health guidance caution zone. The second driver did drive faster in this study, but the thing about field studies is the more the routes are driven, the worse the road conditions can potentially get. So field studies are never perfectly replicated. The only good thing about this path, really, is that the roughest section is also the shortest, and a higher percentage of the route is spent on section 3 and 4. Maintenance to the potholes on section 2 would be very helpful for reducing the operator's exposure here. Musculoskeletal disorders are the primary injury risk from prolonged chronic exposure to whole body vibration. So collecting self-rated musculoskeletal discomfort levels from workers should be pretty standard. There are multiple methods of reporting musculoskeletal discomfort. You've got Cornell questionnaires, Nordique musculoskeletal questionnaires kind of featured here. There's subjective 10-point continuous scales with a body map. Regardless of the method you choose, the two most important components to these surveillance methods are using anchoring words and providing an image of the body. Identifying multiple body parts that the worker can easily show the source of discomfort. So here's a prototype of some seat adjustment training we at CROSH are making for heavy equipment operators. So this is an older prototype, but we will be testing it in a research study with a local mining company. Heavy equipment operators rarely receive specific training about how to set their seat suspension and height. The significance of setting the seat angles correctly, because we want to avoid pressure points, and how to really use that lumbar support properly. If we were to start treating this like office ergonomics, where the worker gets full training on how to adjust all the components of their workstation, it could result in better postures and more effective use of the seat suspension for attenuating vibration. Finally, PPE is really not applicable when it comes to whole body vibration exposure. But you may have seen there are many seat cushions on the market. An example here is the Skydeck seat cushion insert. These cushions are normally designed to reduce contact stress with the seat, as you can see in the figure here on the right. The red portions are the concentrated force of the ischial tuberosities. And using the Skydeck insert on the right shows how that force is distributed more evenly. This cushion actually reduced that concentrated force on the ischial tuberosities by 53%. These can help increase operator comfort, but they have not been proven to reduce whole body vibration exposure. Now let's change gears and talk about hand transmitted vibration. Those scenarios where the worker is holding vibrating tools. Let's start with the health risks. So you already saw that carpal tunnel syndrome is within the top 2 occupational diseases in mining, forestry, and pulp and paper, aside from noise-induced hearing loss. But what is carpal tunnel syndrome? Really, it's nervous system damage. In this image of the hand, the blue ligament along the wrist is the transverse carpal ligament, and the yellow lines are the median nerve. Now, if we look at the cross-section views, the top one shows a normal, healthy carpal tunnel. There is no swelling, the median nerve is not compressed. The bottom cross-section shows what happens when there's inflammation on the carpal ligament or the wrists. This compresses the median nerve. If the median nerve becomes compressed, you can expect numbness and tingling in the thumb and first 3 fingers. This can also result in a reduced sense of touch and temperature. Nervous system symptoms are typically first with hand transmitted vibration. Often workers will have numbness the same day as working. Damage to the vascular system or blood flow is best known as vibration-induced white finger. So episodic blanching or whitening of the fingers is the characteristic vascular sign here. When our vascular system is healthy, we have normal digital artery blood flow. The blood is free to flow properly to our fingertips. But when the arteries have scarring, there are many factors that could cause this. But in our case, we are reviewing the effects of repeated vibration exposure. The scarring causes constriction of the arteries, and this will reduce the blood flow to our fingertips, causing blanching. Or in real life, the whitening of the fingertips. The main trigger for the symptoms is exposure to the cold, but can also be triggered by localized or general body cooling, so in otherwise warm environments. Although vibration exposure causes the symptoms, it does not necessarily precipitate the symptoms. The third system that could be affected by repetitive hand-transmitted vibration exposure is the musculoskeletal system. Here we're looking at tendonitis, which is painful inflammation of the tendons. Keep in mind how small the hands and their muscles are. Muscle fatigue here can also result in reduced grip strength and manual dexterity for the worker. When the tendons are inflamed around nerves, things like contractures can happen. Contractures are that inability to straighten the fingers. Workers can have any combination of the neurological, vascular, or musculoskeletal symptoms, and this would be referred to as hand-arm vibration syndrome, or HAVS. There's another international standard, 5349-1, that outlines how to measure occupational hand-transmitted vibration. So unlike the whole body vibration standard, the hand-transmitted vibration standard combines all of the axes and then uses a single value, 2 meters per second squared, where any measurement above this is associated with an increased risk of HAVS. Accelerometers are used with rigid fixtures and attached to the contact points of the tool, like you can see here. Like we did with whole body vibration, let's look at the exposures for some common hand tools. Keep in mind, the red line here is showing 2 meters per second squared. So values above this indicate the worker is at an increased risk for HAVS. So with every piece of equipment here, the exposures are well above the health guidance caution zone value. Any worker operating this equipment for 8 hours is at risk of HAVS. This really means we need to be careful with how long we let workers operate this equipment. We'll apply the hierarchy of controls to hand-transmitted vibration the same way we did for whole body vibration. For elimination, it would be ideal to have remote operated mobile equipment complete the task or automate the process. Here's a case study with the result of using a different process. In this example, instead of using small pneumatic breakers to take the concrete wall down, the wall was cut away from the building using stitch drilling. It's exactly like it sounds, overlapping holes, using a diamond drill that was held onto the wall with a clamp. So by changing the process, you can see in the results in the table here that the operator's exposure actually became negligible. As a bonus, this reduced the noise exposure and dust debris in the building as well. The cost was estimated to be 50% more than the cost of using pneumatic breakers on the same job, but I think it's worth it. As far as substitution controls for hand-transmitted vibration, we would again pick equipment with lower hand-transmitted vibration exposures, which requires a purchasing policy with the selection specs of the desired exposure levels. In this case, low vibration angle grinders were introduced for welding and metal fabrications. The results from the table, the vibration magnitudes are lower. In extended testing on real jobs in the yard, the new grinders produced an average vibration magnitude of 3.5 instead of 7. The tool is much lighter, and so it's easier and less tiring to operate. The cost of this change was that this angle grinder is approximately $1,000 more. The research and development of the new SOPs and implementation did take a month, and there were necessary alterations to the air distribution system that involved significant expenditure. But again, if you're looking at the time before reaching that health guidance caution zone value, it's a comparison of 1 hour and 17 minutes of work to being able to operate for 5 hours and 7 minutes. For engineering controls, we can provide auxiliary equipment, which reduces the risk of injuries caused by vibration. So this can include anti-vibration handles and machine balancers. We can choose ergonomic work equipment with an ergonomic workspace design. And ideally, we are continuing to work on modeling the hand-arm vibration response to develop effective controls without further exposing workers or laboratory participants. As for administrative controls, equipment maintenance programs are a must. Finding suitable and sufficient information and training for employees is really important too. Limiting the duration and magnitude of exposure as much as possible with break scheduling or job rotation is important. Health and medical surveillance and protecting the employees from cold and damp conditions is really imperative because our body will already start the vasoconstriction of the arteries in the periphery or the hands and feet when we're cold or in wet conditions. For equipment maintenance, here's an example of what happens when 5 bushings on a chainsaw that costs about $10 each in an hour to replace are replaced. The vibration magnitude measured with the same operator cutting the same piece of wood as before was reduced to 5.4 meters per second squared. This would allow about 2 hours of use in a day before reaching an exposure of 2.8 meters per second. The operator had more control of the tool and found it was more comfortable to operate. There are very specific methods of quantifying the symptoms of hand-transmitted vibration exposure. Here is an example of a modified Stockholm sensory neural staging system. So it really helps narrow down which symptoms. On the top here, you'll see the numbness, tingling, weakness, clumsiness, or pain are present and at what level. Then there are systems of numerically quantifying blanching symptoms. So the scores start from the thumb and each finger score is added. The one on the right hand here has 0 blanching on the thumb, a 1 on the first finger, total of 3 on the second finger, and 0 for the ring finger and pinky. While the left hand has 0 blanching on the thumb, 1 on the first finger, 3 on the second finger, and 6 and 6 on the ring finger and pinky finger there. Typically, an occupational physician would be responsible for this level of documentation, but it's important to know to be able to differentiate what's going on with your workers' reports when they come from physicians. Finally, for PPE, there are anti-vibration gloves, but they have very limited effectiveness. We can look at the vibration transmissibility results of 7 work gloves. As you see in the photo, this is a table of the transmissibility results at a frequency range of 31.5 to 200 hertz. The glove ID and major anti-vibration or AV material of the glove are recorded in the first 2 columns there. Then there were 3 force conditions tested with different grip and push force combinations. Under the first force, 2 gloves, B and E, reduced the transmissibility by 12%. For the second force, the best glove, E, reduced transmissibility to the hand by 9%, and the same glove was the best for force 3, but by 8%. We can look at the same table when the frequency range was changed to higher frequency. So here we're talking 200 to 500 hertz. 3 of the gloves, B, C, and D, actually amplified the vibration to the wearer. So they would have been better off bare hand in this case. At higher frequency, glove A performed the best in all force conditions with a 9 to 19% reduction of transmission. So the study really demonstrates how glove selection is extremely dependent on knowing the exposure frequency. Otherwise, you could actually make things worse for the worker. Finally, we can talk about my research focus, and so foot transmitted vibration exposure. So let's start with the symptoms of prolonged foot transmitted vibration exposure. They parallel those of hand transmitted vibration exposure. First symptoms are normally neurological, numbness and tingling in the toes, and reduced sense of touch and temperature. Then the vascular symptoms are illustrated on the right as a condition termed vibration-induced white foot. During a toe blanching attack, the skin of the affected area generally changes color over the course of the attack. Initially, the area goes white as blood flow reduces to the area. and then the skin can turn blue or purple. Finally, as blood flow returns, usually after 15 to 20 minutes, the skin becomes red. This kind of vascular damage and loss of circulation can occur in as little as 2 to 3 months of prolonged exposure to vibration. Without intervention, the damage can be permanent and necrosis can actually occur, or skin tissue, or just tissue death. Then there are also the osteoarticular symptoms, so bone and joint damage or muscular fatigue of that lower limb. The biggest problem with foot transmitted vibration exposure and vibration-induced whitefoot is the pathology. When we were talking about how the arteries of the hand can become thicker from repetitive vibration exposure, thanks to our sympathetic nervous system, the exposure does not need to be direct. Our sympathetic nervous system can cause vasoconstriction of the arteries to our periphery in response to vibration exposure. So I'll explain this further in the next slides. But let's look at the plasmography results. To my knowledge, the literature on vibration-induced whitefoot without the corresponding halves is limited to 2 published case studies. So in this case study here, the worker was exposed to hand-transmitted vibration, but the cold provocation test resulted in damped toe waveforms. So a diagnosis of vibration-induced Raynaud's phenomenon in the feet was determined based on exposure history, compatible symptoms, negative workup for other secondary causes of Raynaud's phenomenon, and these plasmographic findings. And you're thinking, Katie, you had me until that slide. So, more simply put, the worker could be exposed to hand-transmitted vibration and have vibration-induced white finger or vibration-induced white foot, or both. The worker could also be exposed to foot-transmitted vibration and have vibration-induced white finger or vibration-induced white foot, or both. Or the worker could be exposed to both hand-transmitted vibration and foot-transmitted vibration and have one or the other or both. So this, of course, is what can make the cause of the symptoms difficult to isolate. Unfortunately, our attempts to reduce hand-arm vibration have created the exposure to foot-transmitted vibration. So by taking the vibrating tools out of the hands of underground workers and instead creating equipment that we stand on to operate, the contact points associated with occupational exposure to vibration have changed, as illustrated for jumbo drills, bolting, and raised platforms here. Here's a summary of the literature reporting symptoms of foot transmitted vibration in the mining industry. So for jumbo drill operators, 3 out of 5 miners reported moderate to severe pain, aches, or discomfort below the knees. A case report, including a 54-year-old miner with the chief complaint of blanching and pain in the toes. And another study found that 6 out of 27 miners displayed Raynaud's phenomenon in their feet while using drilling platforms. I'm not going to overlap on Flavia and Dawson's presentations for today. So Flavia will be talking about the cognitive effects of foot transmitted vibration, and Dawson will be talking about his research proposal to create a measurement system for foot transmitted vibration. They'll both be outlining some of my PhD research, more specifically. But in short, to have access to all the equipment necessary to identify resonant frequencies, we coupled with a research team out of the Metro Space Lab at Polimi University in Lecco, Italy. Because at the time, the CROSH workplace simulator with the rotopod, it was just being installed and wasn't ready to be used. So I had 4 research objectives. The first 3 in green were human experiments and statistical modeling, and the 4th one in orange was for designing a model. The first study was about resonant frequency identification in a natural standing position at 24 anatomical locations. The second one was measuring the transmission of vibration through the foot when altering the center of pressure location to the forefoot and rear foot. The third one is about combining all that data in a statistical model to determine the number of unique measurement points required to document vibration transmissibility through the foot. And then the last one was to develop a lump parameter model to model the transmission of vibration through a foot ankle system. The first study found the resonant frequency ranges at the toes, midfoot, and ankle, which this had never really been systematically identified before. It's impossible to design solutions without knowing the frequencies that are causing the most damage to the foot. The second study found that as we change our center of pressure, the resonant frequencies do change. So we know that workers don't stand in a natural position, and we needed to know how we have to study working postures in the future. Then using all of that, we found out you don't need 24 measurements. You can capture the entire response of the foot with 4 measurements. And finally, the lumped parameter model worked with reasonable results, considering it's just the beginning of the modeling for the foot's response to vibration. 2 of our Italian colleagues have also made models to advance this modeling further, but we need to figure out how to model the heel fat pad correctly. So what do we really need all of this research for? At this point, we need it to create a measurement and evaluation standard that is specific to foot transmitted vibration. Currently, the whole body vibration standard is used, as it is considered to be applicable to motions transmitted to the human body as a whole through the supporting surfaces, the feet of a standing person, the buttocks, back, and feet of a seated person, or the supporting area of a recumbent person. But the reality is the standard is used to evaluate health risks for the lower back and motion sickness and nausea. So from what you've learned today, how applicable is it for evaluating health risk for the feet? And what are we really doing about measuring foot transmitted vibration? I do sit on the ISO technical committee for the evaluation of human exposure to whole body vibration. We had our most recent meetings in September of 2023. When it comes to the triangle of the human response to foot transmitted vibration, really the 2 sections we have researched in the last 5 years are the biomechanical response with the transmissibility measurements and the engineering with the modeling of the response using those transmissibility measurements. Much more recently, colleagues in Italy have been focused on the cognitive response of a person walking while exposed to foot transmitted vibration. This work is really interesting and is starting to set the foundation of using a more dynamic simulated environment than stationary standing. We'll be working towards eventually separating out how to measure and evaluate foot transmitted vibration, but a lot more research and case studies need to be published to be able to do that. Finally, I want to touch very quickly on the effects of the ongoing COVID-19 pandemic on vibration exposure. In October 2023, a case report of COVID-19 associated with Raynaud's phenomenon in a vibration-exposed worker was published. Raynaud's was identified at a routine health surveillance appointment of an employee exposed to hand-transmitted vibration. One of the main takeaways from the article is that given the high proportion of the population who experienced COVID infection, this is a potential alternative cause of Raynaud's phenomenon to be considered when undertaking health surveillance of vibration-exposed workers. And here's a small portion of a table from another recent research publication about necrotizing Raynaud's phenomenon after recurrent COVID-19 infection. You can see the age and gender of the patients who have reported symptoms to a level that the case study was published and then has been accumulated in a review that was also published. So remember what necrotic means. failure of the blood supply, leading to death of the tissue. All the COVID research is really starting to come out now. There's always a delay between the symptoms of a disease to the reporting, to the researching, to the publishing of the research. So from what you've learned today, you know how the blood flow stops to the fingertips. Although this is not vibration-induced injury causing blanching to the fingertips, it's probably safe to say that a vascular disease will cause vascular damage for the foreseeable future. The main concerns for whole body vibration are musculoskeletal disorders and lower back pain, worsened when the operator has to assume non-neutral postures. We know administrative controls can be effective if we invest in them. We have the potential to keep our workers for longer. Hand transmitted vibration, you saw the main concerns are neurological and vascular damage. This needs to be controlled with multiple levels of the hierarchy on a case-by-case basis. Foot transmitted vibration is still the least studied and is difficult to narrow down the pathology, but research continues to create an occupational measurement and evaluation standard. And the ongoing COVID-19 pandemic, like I said, it is a vascular disease which can result in vascular damage. The extent is really unknown, but it is something to keep in mind for vibration-exposed workers. I'm also going to do a quick plug here for those of you in mining. The Society of Mining, Metallurgy, and Exploration has a health and safety handbook called Mine Safety and Health: Approaches from the Field that will be coming out in 2024. 3 of the chapters in part 2, the ongoing and emerging workplace hazards identification, evaluation, and control, were authored by myself and Dr. Allison Godwin. So the information for whole body vibration and foot transmitted vibration exposure and field line of sight challenges in mining will be available in the handbook. For a list of references using this presentation, please feel free to use the QR code here. I really need to thank my team at CROSH. So Dr. Dorman, Dr. Godwin, Toby, Courtney, and Giselle for everything they do, not only to help me with my research, but also to run events for our community like this. Thank you so much. Please stay tuned for more of our research in the next session. We'll have Flavia and Carlotta, Dawson and Sarah presenting their graduate student research. I can take questions now.